My name is Paul Hernandes, Mayor Pro-tem for the City of Baldwin Park. I'm delighted to welcome you today to learn more about COVID-19 antibody testing that will be taking place in the City of Baldwin Park this December 3rd through December 5th at Esther Snyder Community Center. I have the pleasure of introducing Dr. Douglas H. Harrington, MD Fellow for the American Society of Preventive Cardiology and the American Society of Clinical Pathology, an expert in laboratory testing. Dr. Harrington is also the chairman of GUARDaHeart Foundation, a 501c3, and is available to discuss COVID-19 testing and the implications for public health.
Pleasure to be here. The GUARDaHeart Foundation is a charity dedicated to preventing disease, originally focused exclusively on cardiac disease, but then expanded to diabetes and cancer, and now COVID-19 in partnership with communities throughout the country. And their motto is learn, detect, prevent. It's all dedicated to the community. 100% of funds donated to GUARDaHeart come back to the community. It's an all-volunteer organization.
Thank you. We really appreciate your time and your effort and your commitment to public health. Now we're going to take this opportunity to learn a little bit more about the effort that's going to be happening in Baldwin Park for our residents and our community neighbors. Perhaps we can start with understanding the difference between a COVID-19 swab test and an antibody test. Doctor?
That's a frequent question we get. The swab test is the one that most people are familiar with. It's the one where a little brush-like device goes in your nose, and the purpose of that is primarily directed at symptomatic people, and it's directly detecting the virus. It's detecting the genetic material from the virus. The antibody test is a blood test that requires a blood draw, and it is detecting your body's immune response to the virus. And that is for people who do not have symptoms, and its utility is primarily to tell whether you've had it in the past. And the other value is that it gives the public health departments a better handle on the prevalence of the disease in the community, because it turns out the majority of infections are asymptomatic. In other words, the patients don't even know they've had it.
Right. And can you explain perhaps who should be taking this antibody test?
Yeah, the test is actually appropriate for anybody who is not symptomatic or doesn't have a fever at the time they come in for the test. It's valuable if somebody may have thought they were exposed to somebody in the past, because it's indicative of past infection. It takes about somewhere between 5 and 14 days to develop these antibodies, and it's particularly useful to help our public health department know where they need to target preventive measures or more education, because if they determine that a particular part of the community has a high prevalence of antibodies, then they know they should go in there and maybe intervene a little bit. So primarily that.
Excellent. Is there a segment of the population that should take effort to sign up for this type of testing in our community?
Well, we encourage everybody to do it. We've done children as young as 1 year of age, and we've actually detected antibodies in 2-year-olds, and we're finding that the 19 and under age group has a very high prevalence of antibodies, partly because you know how teenagers feel like they're invincible and nothing's ever going to happen, and they tend to ignore the social distancing rules and parties like that. But it's really important that everybody consider getting it, because the beauty of the antibody test is that it's 100% sensitive and 99.6% specific. And all that means is if you've had it, it won't miss you, and it doesn't give you a false positive.
That's terrific. That's terrific. And perhaps you can share with us a little bit of, what's the testing procedure?
Yeah, the procedure is, and I know you're going to give some more information on this, but we prefer that you register online or through the phone, but you don't have to. We accept walk-ins. And then what happens is you come into the facility where we're doing the testing, and we evaluate you. There's a number of stations. You go to the first station, which is to check your temperature and repeat a history to make sure you're not symptomatic. And then you move on to completing the paperwork, and everybody maintains a social distance appropriately. Everybody's masked. And then once the phlebotomy station is free, then you're shunted to the phlebotomy station. Your blood is drawn, and then you complete it and you leave the facility, and in 3 to 5 days the results will come back to you in a HIPAA compliant online, or it's called box.com. It's free. If you have trouble with that, we can either fax them or mail the results to you.
How long do antibodies stay in our body?
So this is a really important question. The antibodies have a half-life of about 73 days. What that means is that if you peak in 73 days, you'll have half of what you had there. And everybody was concerned about whether that immunity was durable, or in other words, it lasted in people. So the thing I want to share with everybody that's watching this is that there are two components to your body that protect you from infections. The ones we're talking about are called B cells. And even if the antibodies drop down to non-detectable levels, you have memory B cells that the minute you're exposed to the virus again, they come within minutes, they're pumping out new antibody. And the latest paper that I think came out of Harvard suggests that the immunity is durable for a minimum of 3 years. We still are collecting data on that. But the part that I really want to stress is there's another component to your body. They're called T cells, and they directly attack the virus without making antibodies. And the reason that's important is because most people have had a common cold, and it turns out about half the population, because they've had a cold, has T cells that will attack the COVID-19 virus. And the reason I want to stress that is because we've all talked about herd immunity and these vaccines. It turns out the level of immunity in the community that we need to achieve is around 60%. Right now, the population in the United States has about a 10% immunity rate. So you know we need to move that up. But if you include the T cells, about half the population probably is already there. And so the fact that we have these vaccines coming out will move that up very fast. So the reason I'm saying that is there is hope.
Thank you. No, we obviously are hoping for that, for the best, and a quick production of that, and hopefully, we'll take care of first and foremost our first responders, our health and medical professors, professionals, and also perhaps our educators, right?
Right.
Get those kids back into school. So perhaps you could also share what happens if I receive a positive test result.
So there's two types of antibodies in your body. One's called IgM and one's called IgG. If you have IgM only, that suggests that you were recently infected. And what we recommend in that setting is that you quarantine for at least 14 days and then repeat the test to determine if IgG, the other antibody, appears. So remember, there's two. IgM, which is the first one, not as specific as the IgG. And so once we see IgG, all of the evidence suggests that the amount of virus in your body, if any, is significantly reduced and you're less likely to infect somebody. So the reason we recommend repeat testing after 2 weeks is to make sure the IgG is appearing.
Is it true that Latin community and African American communities have the highest rate of COVID right now? And if so, why?
So if you look at the national statistics, the answer is yes. The interesting thing is we've done testing in the LA County and LA Basin, and the Hispanic community does hold up, but the African American community has been running around 4%, 3 to 4%. I think it's largely due to some proactive community intervention where there are a bunch of volunteer groups, community organizers that have been working with them. The difference between that and the Hispanic community is that the Hispanic community is very family-centered, and they tend to have congregations of people to celebrate things and often share houses, and they're also heavily involved in service industries and more likely to be exposed. So in this area, they're running about 14%, not as high as nationally, which means that I think the public health initiatives are helping. There is one other issue which I'm going to stress here, and finally it's starting to be written about, is that it turns out that we know that COVID comes out in droplets. That's why when you shout or sing or whatever, it's a problem. What people forget about is it also comes out in your urine and your feces. So a toilet it can fling droplets up to 20 feet away. So we really encourage people, if you're in a public bathroom, keep your mask on and wash your hands very carefully afterwards. But if you're at home, close the lid if you flush the toilet. And the reason I mention this is because we can actually identify community outbreaks by checking the sewage for COVID-19. That we know we need to go into that area.
Is the antibody test FDA approved?
So there are no actual FDA approved tests for COVID-19. There is, however, something called the emergency use authorization, which is FDA approved, in other words, by that process. And so the only tests that we use are what we call EUA approved. And we prefer that if people are going to get tested, that they only do those because the FDA has scrutinized their data.
Perfect. Well, thank you. What are some other simple tips that we could help to prevent the spread of coronavirus besides, wearing masks and washing our hands?
Yeah, and I've already mentioned the bathroom, which frequently gets overlooked. That's an important one. But there are things that you can take. It turns out that the virus damages your body's ability to use vitamin D, and vitamin D actually protects you from the virus. So we recommend people take at least 5,000 to 10,000 units of vitamin D a day, because even in California, where we get a lot of sunlight, you don't get enough to drive those levels up. And a significant portion of the population is deficient. That will definitely protect you, as will vitamin C, and another vitamin called quercetin, Quercitin. You can get those on Amazon or anywhere. The other important thing is getting enough sleep to keep your immune system up, eating a healthy diet, and avoiding stress, which is very difficult in this environment. And there's also some compounds that boost a substance in your body called glutathione. It's an antioxidant that your body makes naturally. Things like whey protein, or you can buy a supplement to help boost it. Those actually really boost your immune system and are helpful. The message I would like to deliver to the community here is that vaccines typically take a long time to develop. And when Ebola broke out, we started developing some new methods to accelerate the speed with which vaccines are developed. And I think recently we've had at least 2 vaccines that are being have been shown to be 95% effective. Mm-hmm. And then there are 2 more that just came out from J&J and AstraZeneca. And that is a remarkable achievement in the sense that the flu vaccine is only 40 to 60% effective. And the FDA had said that the COVID-19 virus vaccine had to be 50% effective. So I'm just floored by how well these companies have done in developing these. Now the biggest question we get is, are they safe? And for all practical purposes, the studies that have been done indicate that they are safe. But they have not gone through the same level of scrutiny that, for instance, the measles vaccines went through back in the beginning. But we're using entirely new methods to develop them. So I think the main message is that the FDA will not allow them to get an EUA unless they have determined that they're reasonably safe for the community at large, and they will be monitoring it very closely. And some of these rumors about being tattooed and stuff like that, that just isn't part of this program. This program is really meant to kind of get us to that herd immunity level as quickly as possible.
Great. And considering that we're now in the flu season, do you also recommend people getting the flu shot? I mean, I had the opportunity last Friday to get one. I've been taking one for the last 15 years. So what are your thoughts on that?
We heartily recommend it, because I will guarantee you that some of the things that we're seeing in the clinics, it's flu, it's not COVID. It's still out there. And unfortunately, we're just reporting COVID and it's gotten all the attention, but the flu can be a very serious illness, and we heartily recommend that you get the flu vaccine.
For event details, the City of Baldwin Park has partnered with GUARDaHeart Foundation to offer no-cost COVID-19 antibody testing to the community from December the 3rd through December the 5th from 9 a.m. through 4 p.m. located in the City of Baldwin Park Esther Snyder Community Center, located at 4100 Baldwin Park Boulevard in Baldwin Park, California. Free parking will be available in front of the site. For individuals without access to internet or who need assistance in Spanish, please call 866-299-8998.